Hello everyone! Today we are going to be discussing a question from Typical PT's platform. Let's jump right in. Here is the question. A 40-year-old man with type 2 diabetes, neuropathy described as pins and needles, and a history of prior falls presents to the emergency department. His labs show a hemoglobin of 11 grams per deciliter and a random blood sugar of 250 milligrams per deciliter. On foot examination, he has a shallow neuropathic ulcer on the dorsum of the right foot, measuring about 2.5 centimeters in diameter. The wound has a clean base with pink granulation tissue and a thin rim of slough. There is mild to moderate serous exudate, no odor, and the surrounding skin is mildly erythematous but not warm. The dorsalis pedis pulse is palpable. Capillary refill is less than 2 seconds, and there are no systemic signs of infection. Given this presentation, which wound dressing is most appropriate today? Here are your answer choices. A. Collagen. B. Hydrogels. C. Hydrocolloids. D. Impregnated gauze. Go ahead and pause the video right now. Think through the logic and lock in your answer. When you are ready, hit play again to see the solution. Welcome back. The correct answer is choice C, hydrocolloids. Before we break down the explanation, let's take a look at the wound description shown in the question. The wound is described as superficial and neuropathic, with a clean base, pink granulation tissue, and mild to moderate serous drainage. There is no odor and no systemic signs of infection. These details indicate a clean, non-infected ulcer with ongoing exudate that needs moisture balance rather than aggressive drying or antimicrobial coverage. Now, let's explain why this answer is correct. Hydrocolloids are occlusive or semi-permeable dressings that maintain a moist environment, absorb low to moderate exudate, and promote autolytic debridement. This makes them ideal for a clean, superficial, non-infected neuropathic ulcer with mild to moderate drainage on the dorsum of the foot. They also have a typical wear time of 3 to 7 days, which reduces dressing change frequency and shear. In this case, the wound is not infected, not heavily exudative, and does not have an exposed tendon or bone, so hydrocolloids are appropriate. That is why the correct answer is choice C. Now, let's go over why the other choices are incorrect. Answer choice A, collagen, is incorrect. Collagen dressings can stimulate granulation and extracellular matrix deposition, installing or clean granulating wounds, but they do not handle exudate as well as hydrocolloids and are more cost-intensive. They may be reasonable later if healing stalls, but at this stage, managing moisture is the priority. Answer choice B, hydrogels, is incorrect. Hydrogels donate moisture and are best used for dry or necrotic wounds, such as rehydrating dry heel eschar. In a wound with mild to moderate exudate, hydrogels increase the risk of maceration and do not control drainage as effectively as hydrocolloids. And finally, answer choice D, impregnated gauze, is incorrect. Petrolatum or bismuth impregnated gauze provides a non-adherent contact layer for superficial or partial thickness wounds, grafts, and donor sites. However, it offers minimal absorption and requires frequent changes, making it suboptimal for a neuropathic ulcer with ongoing exudate. Now that you've completed this case, take a moment to record the key points in your Typical PT digital notebook. Use it to organize what you've learned and reinforce how to apply core integumentary concepts when evaluating and managing skin-related conditions. Thanks for watching today's question of the day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at Typical PT for daily study tips, quick reviews, and motivation to keep you going.